well, if the whole psychological association agrees with this, it must be right. No, the whole association doesn't agree with it. Okay. But just most people are afraid to speak out. And what it is if you're talking about, as you say, a human right, okay, if we're trying to be compassionate, all the evidence shows that a child before puberty has no idea whether they're going to continue to say, I am trans after puberty. We don't know that.
Welcome to the Reality Therapy Podcast, where the truth will set you free.
Welcome. I'm here with Dr. Oren Amitay, who is a clinical psychologist and host of the Awake at the Wheel podcast. I think we're going to have a fascinating conversation. So, Doctor, welcome.
Thank you. Glad to be here.
So, starting out, tell me a little bit about yourself and your background.
All right. Well, I am a clinical psychologist. I went into psychology after years of doing a bunch of different stuff that was not really academically inclined. Traveled to Japan. I went back to school for a year just to shut my mother up. Didn't like it. Was going through a bunch of personal stuff at the time. Thought, why am I doing this? I made so much more money teaching in Japan. I had opportunities, so I thought I wouldn't do it again. But then after a few years of running a Japanese English Canadian language school and cultural center in Toronto, I realized that this was not really going anywhere. So I was going to get married. And so I decided, I've got to go back to school. I can't do anything without a proper education. And during all my chaos previously, when I first went for that first year, the one course that didn't go to hell during the chaos was psychology. I still managed to pull an A+ on that one. So I just thought, I'm going to try it. Went back, and with the intention that when I went back for my second year, I already bought the book for the GRE, which people today, I don't know if they're still doing it, but the graduate record exam, like I was prepared, like I'm going to do this. And I thought, all right, I'm going to do 4 years of undergrad, 1 year of master's, 4 years of PhD, and I'll be out. I'll be, still relatively young. I didn't know for clinical psychology, it's 2 years for master's. And in the program that I was at, 4 years never happened. It was like, I think 7 or 8 years. I think it was maybe 7 years. It would have been 6. But there was a problem at the hospital I was working at, so it ended up being 7 years. So it was a much longer stretch than I had planned. But, I was in it, and I think I have an aptitude. I realize I can read people pretty well. I understand pattern recognition. I love the human behavior, and that just got me going. And, from there, while I was doing my, my schooling, I had a bunch of internships, and that's where you get your real education. For anyone who goes into clinical psychology, at least in Canada, you learn to be a researcher. You get your actual, true training through the practica, through the internships. And I took on more and more because the person who ended up being my mentor, he was the head psychologist at a hospital, and he was doing a lot of private work. So there were a lot of opportunities. I was getting paid very well as a student to do what I wanted to do. And again, that was the real education, the internships.
I love that. I love that journey to clinical psychology. Especially one thing that you said stood out to me, and that's pattern recognition. There's obviously like a very human element to the therapy profession, but this idea of pattern recognition, my background is addiction treatment. And, you say, okay, you do this behavior, this feeling comes up, you use drugs. Like you start to identify these patterns so that you can catch things early on. And that makes life so much easier when you're able to see like the pattern and see what's going on. Can you flesh that out a little bit for me?
Well, that's part of it, yes. But also, if I'm hearing about somebody, and I have to be very careful here because I have seen way too many, let's say, psychologists or therapists who I think they see what they think is a pattern. They see 1 or 2 dots or data points, and they suddenly make a whole bunch of assumptions about the person or the situation, which may be entirely inaccurate. So I look for quite a few data points, and if I see that, then I go, okay, I just know that if someone, let's say, does A, B, C, D, there's a very good chance that, they have this issue or their personality is like that. Or if you act in this way, here's how they're going to react. So to me, that's the pattern recognition. Again, it's not 1 or 2 data points. It's a number of them and having a really good sense. I mean, because humans are complex, but we're also pretty simple. Okay. Like, there's certain principles that that drive us. And if you work with addiction, it's funny because somebody who was a student of mine, and then I mentored him and he became really big in the addictions field. And I could see it when I first met, there's pattern recognition. When I first met him, I could see that he really understood people. And when he's talking, I felt like he got people. And I told him that. I tell this to anybody. I say, if you can get people, or at least make them feel that you're trying to get them, I say everything else is gravy. That's the thing. And it's not just empathy. There's something else. Just being able to sort of make someone feel that I'm trying to understand you. I may not have had your experience in life. Maybe I never had schizophrenia. Maybe I was never addicted to heroin, but when I'm sitting here, there's no judgment. I'm just really trying to take in what you're saying without, again, no prejudgment. I'm really getting it, and I'm trying to understand from your perspective. And he had that. So for him, it's funny because he works in addictions, and he sees exclusively people struggling with various addictions. So when he and I would be talking about, let's say, a client that he had that maybe he'd given to me, and we're talking about the person or whatever the case is, he would just default go, okay, they're back on, like they're off the wagon, or they're doing this, or they're doing that, or, this is going to be a problem. And I was like, come on, I think you're exaggerating, because I didn't have as much experience with him, but he had seen so many cases. And most times what I thought was, again, a grossly exaggerated reaction to someone's experience or to what they're saying, he was bang on. So his pattern recognition was so honed. Now, maybe, of course, it's biased because that's the field he's in, but damn it, it was pretty accurate almost every time. So that's pattern recognition to me.
Yeah, I love that. I mean, there seems to be like a couple things that could potentially, not necessarily, but could potentially be in conflict. And one is this idea, part of it's pattern recognition, and the DSM is like this big book kind of pattern recognition. Like, here are some patterns to look for. And I think it's easy for a lot of people to say, okay, I found this pattern. Here's this box to put you in. But you also mentioned this very human element of empathy. How do you square both of those at the same time?
Well, you have to be really open-minded. I mean, it's critical thinking. Okay. So even though I see something, I think, oh, this is a sign of, or a potential sign of, that's just kind of like a resting place saying, okay, it's a possibility. I'm having like a case formulation, so to speak. I haven't put a stamp on it saying, okay, this is what it must be. So that's one thing where I'm saying it's hints, it's clues. It helps me kind of understand the person a bit, but I know there's so much more. This is only a tiny piece of that person. In this moment that we're talking about, this might do me well. I might know how they're going to react or how they're feeling in this context, but I know there's so much more of them. And so I don't want to just go in there thinking, aha, I know you. I don't. I know this much about you in this moment. And I'm completely open to hearing so much more about you. And that's how you balance the two. And again, I've seen a lot of people. I remember one time I was doing an assessment with somebody in a hospital, and I had been trained in another hospital. I'm not going to mention names, but it's a very rigid, very cognitive behavior therapy only type of approach. And I saw how many patients they harmed. I saw how many interns they harmed. It was just a very rigid approach that was not like, it didn't take the human element at all. All right. We're in session 3. Here's where you should be. Okay. Regardless of what you come in with. In session 3, the book says this is where you should be. And if you're not, there's something wrong with you. Now, no one said that, but that's kind of the sentiment that was conveyed. So I was at this other hospital doing an assessment. And for this one day, somebody from that other hospital was coming in, and they wanted him to sit with me. Okay. He had more experience with me. And so we were assessing somebody. And he heard, and I could see him change. Okay. So I was doing my normal approach, which is very, like, even if I'm doing the SCID, which is the structured clinical interview for the DSM, even if I was doing that, it was very conversational. Because I want people to feel comfortable. So I'm just asking questions. Even though I have a bunch of questions I have to ask, it's done in a more organic way. And as soon as he heard one sign that he thought was of bipolar, suddenly I saw him switch, and every question, it was like, pop, 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 pop. It wasn't conversation. It was, okay, I'm looking for the symptom, I'm looking for the symptom. And I saw the patient kind of react as well. Like, there was a different energy, right? So, I can't remember if the person did have bipolar disorder or not. I don't think they did. But again, because he saw that one pattern or that one data point, he suddenly went into this mode, and I could just see him asking these questions, and he wasn't even going along with this. Like, he memorized the skit, it seemed, because he's like, pop, 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 and it just changed the whole dynamic.
Mm. Wow. Yeah. That's interesting. You brought up CBT, and I want to kind of get your thoughts on CBT, because I feel like pro CBT people are like, this is where all the evidence is. You got to be CBT. And then you've got like your psychoanalytic people who say like CBT is shallow. I followed this one psychoanalyst who said I could teach a chimpanzee to administer CBT. And then you've got a lot of social justice type people who say CBT is gaslighting, so what's your take on CBT?
Okay, so I've been trained in 8 different orientations, and CBT was one. And the person who I trained under predominantly in CBT learned from, like, he trained under Aaron Beck, the creator of CBT.
Wow.
Yes. So my lineage is pretty solid, because a lot of my colleagues who, let's say, were more humanistic or psychodynamic, they hated CBT, but they didn't know enough about it. It just seemed, as you say, shallow, superficial. So they were going from, let's say, I think they were a bit prejudiced against it, whereas I was like balls deep in it, and I got to see all the limitations straight up. Okay. So, or firsthand. So my thoughts on CBT, I say that CBT, and this is part of when I'm teaching about it, I do this long spiel. I won't do the long spiel, but in the end, when I'm lecturing to my students, I say, okay, and here's the final point of the story. And I say, write this down very clearly. I say, CBT is very effective for those for whom it's very effective. Okay. And I watch students, they're kind of like, some of them just writing down, they're not thinking, others processing, what did you just say? And I say, and that's a fact. If it gels with your way of thinking, if you're the kind of person, and by the way, I am, okay, I think about 5% of people can really do well with CBT, in the sense of, if someone says to you, hey, stupid, I mean, I'm being a bit harsh here. Okay. But this is wrong. What's wrong with your thinking? Smarten up, do it better. And they don't care about, you know, they're not worried about the feelings being hurt or whatever. They just want a solution. All right. They want to be told, here's where the flaw is. Here's how you correct it. So someone who's like that, which I'm just estimating about 5% of the population, it works very well. Okay. Engineers love CBT because they're very,
Analytical.
very analytical in that regard, right? Logic based. So you tell them that, they go, okay, I get that. So CBT, by the way, it's not necessarily a problem of CBT. It's more of how it's administered. So I've had so many, and I alluded to this earlier. So I've seen many therapists, and again, I was working in a place where it was all CBT, and I saw the people training it, and I saw the people doing it, and I saw the shortfalls of it. Which is it basically, again, it assumes that this solution, this algorithm, works for everybody, regardless of who the person is, regardless of where they are. And there's a lot of shame in it, because CBT, the thing that made it unique when it first came out was, unlike every other therapy, where the presumption was that the magic works in session, right? The client therapist relationship. That's where, the change can happen. CBT said, no, no, no. It happens outside of session. You take what you learn and you apply it through homework. And so I saw so many patients, whether it was in my groups or others, actually my group was different, I'll tell you about it afterwards, but where they felt so much shame because they weren't able to, let's say, challenge themselves. If they had a phobia of elevators, they didn't do what they were supposed to do. They didn't 3 times a day go to an elevator and try to take it up, every single day. So they'd come back to group and they'd have to, report that they didn't do it. And I saw them get shamed. Well, if you're not helping yourself, how can we help you? Okay. These are the tools. You have to use them. When I do it, I always tell everybody, I say, here's what we're going to do. Here's the first week. I do breathing first, because that's the first thing patients of mine learn. Everything starts with breathing, because breathing allows you to slow things down. It's really hard to activate some higher functioning cognitive behavior technique when you're in anxiety mode, or if you're really angry, okay, if you're feeling like you can't get off the couch, right? It's difficult to do that. So I say the breathing just regulates your system, clears your head out a little bit, and now you have a better ability to potentially use what you've learned. And even then, I say you're probably not going to do it. So when I give techniques to my patients, or I give them homework, I say you're probably not going to do it. I say, this is not reverse psychology. I say, I'm just letting you know that, if statistically speaking, I'm betting against you, because I know most people in your situation aren't going to do it the first time round. I say, it'll take time. I say, when you're ready, you'll get to do it. And the sooner you do it, the more you do it, you will feel better. You're going to recondition yourself. CBT is a lot about reconditioning. It's about reconditioning in a controlled manner, where you are in control. You try to master some level of whatever you're dealing with, try to feel comfortable with that, build on that, and build on that success. It's systematic, it's methodical, and it does make sense. But you have to be able to get the person where they're at. And again, CBT kind of enforces where again, like I said, we're on session 3, we're at session 4, here's where you should be, rather than how do you get them to be in that place if they're not, if they're having a hard time getting there. So that's, I think, the flaw with CBT and the way it's delivered. And it just seems so mechanical. And as you said, it seems to be like it's more superficial, it deals with the symptoms rather than the underlying causes. But in theory, CBT is supposed to get to those underlying causes. They do want to work with core beliefs, kind of rules and assumptions that you learned much earlier on and internalized and aren't even aware that you're following them. And it's supposed to help explore that. But it's done in such a mechanical way. And there's almost a placebo effect, because the person's being told, hey, if we just change this, or here's the problem here, here's your overly negative thinking, right? So if you just change this, you'll feel better. And how are you feeling now? Oh, I'm feeling much better. Rate it. I was feeling 80 out of 100 distressed. Now I'm feeling 30. I must be doing better. Okay. So there's a bit of that going on. And hey, kudos. If it works to some degree. but it doesn't necessarily get to the really, really deeper issues, the unconscious issues. You can't just, I mean, CBT, interestingly, the whole point when Aaron Beck came up, like he was in a psychoanalytic institute. He was trying to basically manualize psychoanalysis. The core beliefs was supposed to be getting to the unconscious. He wanted to make a way so that a therapist could learn how to help patients step by step get from the automatic thoughts, get from the conscious down to the unconscious. That was the intention. I don't think it really plays out that way. There are other ways to get that because the unconscious, you guard against it. Okay. There is some really scary stuff that people don't want to address. So to be able to get the person to feel confident enough, safe enough to go to the ugliest places of them, about themselves, right? That takes effort. That's where you have to make them feel like, again, you're safe with me. I'm not going to judge you. The things patients tell me, okay, right? Like it's incredible. It's just like some of the darkest, deepest, scariest, most shameful stuff. And I feel honored that they feel safe enough to share it with me. And if you can't get to that level, it's really hard to make those deep, fundamental, lasting changes. I know I talk
So
a lot.
you don't feel like CBT is a effective gateway to the unconscious or like a psychodynamic process, like one would lead to the other?
It can be if it's used in conjunction with the other strengths, like, a very empathetic approach. Again, someone who does CBT properly, I think, can sort of kind of get there. Okay. It has potential to be used that way. And that's why now they have mindfulness-based cognitive therapy, because they recognize, wait, we have to put the person in a proper state, in an emotional state, in a physiological state where they can actually process what they're doing. Because if they're kind of like, anxious or they're feeling uncomfortable, and they're trying to deal with these difficult subjects, it's superficial. They're not really going deep. Like they're digging, but they're not digging all the way to the stuff that really causes them that discomfort. They're only going halfway or three-quarters. So it can help. Okay. So, and I use CBT partially. It's funny. One time I was with a patient, they had OCD, and we were like, I basically did a very, very CBT type exercise with them. Okay, because it just called for it. It was just an exposure exercise. Because CBT is very good when it comes to, let's say, phobias. You don't have to go too deep for that in most cases. Sometimes you have to go deep. There's some deep hidden, cause. I'll give a story about that in a second if that's okay. It was more about OCD. But anyway, so I did this very CBT type approach, and the patient said they said, that's really sounds like CBT that I've heard about. Blah. He said, can we do it? And I said, actually, we've been doing CBT the entire, last 3 months. Okay. You just didn't know it because I'm more organic. I'm using the same principles, right? But not in this very pedantic, blah, blah, blah way, right? That organic part is what makes it, more, I think, accessible and successful. So if I can just throw something out there, if you don't mind, it's just because I'm going to forget. So one time, one of my patients, she had OCD, and it just in talking with her, I thought the cause of the OCD, it was a lot of, let's say, conflict in the household, okay, with her parents. And so like there was never a sense of control. There was never a sense of stability or predictability. So she sort of came up with these kind of these rituals and all this other stuff that sort of gave her an illusion of control. And the timing made sense. The immersion, the immersion, not immersion, sorry, oh my gosh, the appearance of, there's another word for that, okay, but the appearance of her symptoms started around the time, and the narrative that we created together made a lot of sense to explain how her OCD developed. All right. And her OCD was washing hands really badly. And at the time I was still training with my mentor. So I told him, the story. And as soon as I'm telling him about washing hands, he goes, oh, it's about sex. It's shame about sex, right? And I said, in all the talks we had, sex never came up. It's like, and I told him the narrative that we had created. He said, well, okay, that makes sense. And he was very calm about it. Okay. He didn't say,
Psychoanalytic?
yeah, he's psychoanalytic. Yes. He's very psychoanalytic, more psychodynamic, but also psychoanalytic. So yeah, exactly. So he was very calm and patient. He said, okay, fine. Didn't say anything beyond that. Next week, I told my patient, I said, I got to tell you, honestly, here's what my psychoanalytic mentor told me. And I told her about that. And I was smiling and saying, I know that we know what the real story is. Okay. And she said to me, okay, well, actually, I got to tell you the truth. She said, I was really thinking about it last week after we talked about it. And she said, and I'm not going to give the specifics, but basically, the OCD symptoms actually did come around, started to emerge. That was the word I was looking for, I guess, appear around something sexual. And it was about shame. and it was paying on. So, and he didn't know any of that. He just, he went through this model. His pattern recognition was if it's, washing hand or something like that, very psychoanalytically, it's about sex and shame. Okay, it doesn't have to be the only thing, but there were a number of cases like this where you tell me these crazy, wild psychoanalytic interpretations. I would explore them with my patient, usually half mockingly, and a lot of times they were right. Okay, so
That reminds me of Shakespeare's Lady Macbeth. Are you familiar? Yes.
out, damn spot.
Yes. Yes.
Yes, yes.
Yeah.
Yes, actually,
Wow.
that's my favorite Shakespeare's play, by the way, and Lady
It's a good
Macbeth, that
one.
scene. Yeah, I love that. Yes, out, damn spot.
Yeah. So I have a hunch, a hypothesis. I don't have evidence to back it up, but I want to run it by you. I think CBT is more effective for addictions than other issues. And I'm just from the work that I've done, you can explain things fairly simply to people. I don't want to sleep on the street tonight. If I use drugs, I'm going to get kicked out of my halfway house and sleep on the street. Therefore, I should not use drugs. Pretty simple, like if I want this outcome, I should do this behavior, not this behavior. REBT, which is similar, seems to be very good at analyzing relapses. I had these thoughts, these feelings led to this behavior, this consequence. It seems like even people who are not highly educated can understand this like simple line of logic. Does that resonate with you?
Definitely, I work with a lot of people with addictions, and I certainly do use, CBT principles with them. CBT in of itself is not sufficient. I think it's necessary, but not sufficient because, and I'm sure, oh my gosh, Gabor Mate,
Yeah.
the realm of hungry ghosts. Every addict knows that, right? So,
Yeah.
so for him, sorry, from my knowledge of his approach, right? I tell the patients with addictions, we do talk about this very logical, the action consequence, and trying to change that. I say the thing is, what we have to understand, what we have to get to, I say, is you understand that, you logically get it. So what is it about you, your programming or whatever, that prevents you from acting on that logic? That's the approach I take. I say, and I go, we got to shift from this child brain into the adult brain. The adult brain is the CBT. I say the child brain is more the unconscious, the psychodynamic, the shame. I say, how do we, and I always tell people, I say, you can feel guilty, you can feel embarrassed, you can feel ashamed. I say, but we can't let you sink into shame. This is my approach. I say, because saying I did a shitty thing is very different from saying I'm a piece of shit. If I feel like I'm a piece of shit, how am I ever going to get better? So I tell people, I say, I don't know what you're going to do to be able to differentiate between shame, like I'm a horrible person, and I'm ashamed of what I did. I say, but that's what we're trying to do.
Would you say, if we're mapping this onto kind of like a psychoanalytic brain, the ego is corresponds with CBT and the id corresponds with psychoanalytic or dynamic?
I would say that. I mean, the ego definitely is more of the logic based, trying, for sure. So the adult brain, 100%. Exactly. So again, if the id is running wild, or if the super ego is so harsh, okay, again, where it's just building that, or it's just infusing you with so much shame, right? How do we overcome that? How do we get past that in order to access that, the ego base, or the CBT approach? So for sure. So I mean, again, and that's what that's I think a real strong foundation of what I do with patients. Like I said, is trying to get them to be okay with just how, well, let's say, deficient they are as a human being. And I start with my own deficiencies. There's always this question about how much do you self-disclose? And whenever I do, I always think, how is this going to be interpreted? Is there a risk that it could be misinterpreted, and so on? So I have this quick, calculus before I say it, but I will say certain things because I want the person in front of me to know that I'm not standing from a position of judgment or morals or anything like that. I say, I'm just as flawed as you are. It manifests in different ways. And if I can admit it and I share a few things, I try to help them kind of feel more comfortable, let the curtain down, go a bit deeper, okay, and find out once again, what is it about you that prevents you from accessing that part of your mind that wants to get better?
Wow. Okay, shifting gears a little bit, when did you get licensed?
I think it was 2008, I want to say. Yeah,
2008.
it was 2007 or 2008, around that time.
One of the things I like to explore here is political bias in grad school and the way that we train therapists. I get kind of different answers, but it seems like if you were trained less than 10 years ago, you got a heavy dose of political bias. But more than 10 years ago, it seems like people got a really good education. I'm wondering what that was like for you.
Yeah, definitely. Back in my days, It wasn't about political bias. It was more about orientation bias. If you're going to a certain school, there may be more CBT. Maybe it's more humanistic. Maybe it's right. It's more psychodynamic. That was the bias that you had to be aware of. I mean, I remember going for an interview for grad school, and I didn't even think about that. And I was sitting waiting to go inside, and someone said, "Hey, this is really cool. At this university, they're more psychodynamic." And it's like, oh, I didn't even know that. So like I hadn't done my homework. So I had to prepare myself to, to bluff that way. So, and where I went, it was mostly humanistic, client-centered, process experiential, and emotion focused. Because one of the creators of emotion focus, one of the people I trained under, was there. So that was the bias. And there was one person doing CBT at the time. Okay, where I've been teaching for the last 25 years, it's when they brought up when they created the psychology department, the grad school. They only had an undergrad, then they made a grad school about 10 years ago. Then they brought on almost all CBT, right? So that was the bias I had to worry about. However, in the last number of years, having taught so many students, having still taught at the universities, you're 100% right. The political bias, the ideological bias has overtaken anything. And I think it's quite frankly, I think it's harming our field. Okay. I hate to say this, but no knock against social work, because social work has its place. My assistant, she used to be a social worker, or she is a social worker, but she's my former assistant. She was amazing at what she did. And I have some patients and students who are social workers. So I'm not shitting on social work. Okay. Itself. But there is so much bias there. It's all ideology, and it's ideology that's not even practice. They say, be like this, don't judge, do what, okay. And the people, they're so hypocritical. I'm not saying everybody, but many of the professors are. And I've had so many social work students hear me say that, and they get angry at me. And then they go into either a fourth year or they go into grad school, and they come back and they've said, I see what you mean. I'm sorry. You were right. I thought you were a jerk, but you're absolutely right. So I have seen that type of approach, that social work attitude, okay, infuse and take over and pervade psychology, quite frankly. Okay, a lot of social justicey type things, a lot of take this as a fact. There is a gender or this or that, okay? And if you dare question it, you're getting excommunicated.
You know, Jordan Peterson's also a Canadian. I'm not sure your thoughts on him, but it was probably like 2017 when kind of that whole thing blew up with him. And I was pretty radical as a lefty back then. I just assumed he must be bigoted. He must have all this prejudice and whatnot. And, kind of getting into a counseling grad program myself, I think, my gosh, the bias is just overwhelming, heavy-handed. I'm wondering if you could go into a little more detail about what you're seeing north of the border over there.
Yes, well, Jordan Peterson, I was maybe the first psychologist who gave him a platform. He did a talk in my class. Many people saw it, not on my channel. Very few people saw it. Other people took it, cut it, split, and made their own videos. Okay, so he got millions of views on that. I'm not the person who propelled him. Joe Rogan did, but I'm just saying that before he became the Jordan Peterson, before it became safe to actually say, you know what, he's got some good ideas. I saw what he was talking about, and I wanted to platform him. And I got in big trouble for that. That was the start of my downfall in the Ontario Psychological Association. So people have to understand this. There's the College of Psychologists of Ontario, the CPO, and there's the Ontario Psychological Association. So the CPO regulates us. They're the body under which the college under which we get registered. The Ontario Psychological Association is a volunteer organization made up of like 5,000 psychologists in Ontario, and you need to either be part of them or the Canadian Psychological Association in order to get your insurance. Without insurance, you can't practice. So you have to be part of one of these two bodies. So I got banned for life from the OPA. People hear that and they think I was banned from practicing. No, I'm still a psychologist in good standing, but the Ontario Psychological Association banned me for life in 2019. And it all started because one of our colleagues, an older gentleman, it was 2016 that Jordan Peterson made this famous 2 videos on pronouns and what he was portending what would happen. And it did happen. Okay. Portend, not pretend. He knew what was happening. He saw it and he predicted it. And people thought he was crazy, a transphobe, whatever. Now, his language at the beginning was a bit harsh and crude. He's learned to refine it. He's really good at it now. But before, he was kind of blunt. Okay. So what he was saying back then, I heard it and I said, yeah, I mean, I agreed. I'm not as, let's say, brash as he is or as he was. Okay. I'm a bit softer, quite much softer than that. But I could see the logic in what he was saying, and I was seeing it myself. So one of our colleagues in the OPA, he posted something on the listserv saying, isn't it great that psychology is getting in the news right now? Jordan Peterson was blowing up. It was I think October, November 2016. That's when it all started, 9 years ago. And so this colleague wrote about it. And a whole bunch of people wrote back saying, some of us are not so happy. He's a transphobe. He's a bigot. And they just started. And these are psychologists. Okay. Not high school students, not university students, psychologists just went the whole da 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 da. Okay. And so I jumped in saying, like, what are you talking about? And I challenged them. And from that point on, I started posting papers. I started posting articles. I started saying what he was saying is correct. And I would post it all the time. And people would come at me and get very angry. And they would start putting words in my mouth. I'd have people making, this is public, well, public in the sense it's a listserv. Okay. I also got a back channel as well. But people would be saying, like, I can't believe you work with anyone from the LGBT, blah, blah, blah. Like, how they can't be safe with you. Some people are threatening to make complaints against me. These are colleagues. Right. And so that's how it started. And so that really opened my eyes to the political bias. It was 2016. And it's funny because I'll just tell you right now, I forget why I said it, but it was maybe a few months in, and I wrote a post. I can't remember if it was publicly or back channel, but I basically said to this person, someone I knew, and I said, we are psychologists. We should be better than the average person when it comes to being able to, let's say, detect BS, to be able to bring nuance to a discussion, to be able to critically think. I said something along those lines. And she said to me, that's the most shocking, something like elitist thing I've ever heard. And she was like, and I'm reading this in her email. And I said, wait, I said, is it so crazy to say that I would expect an accountant to be better than the average person at math, or a basketball player to be able to, jump higher? And that didn't sway her. She still thought that my saying that as a psychologist, we should be able to think more critically, bring nuance and so on, that was somehow shockingly elitist and a horrible thing. And she couldn't believe it. And then I brought this to the public listserv. Okay. I wasn't throwing her under the bus. I was just mentioning that, trying to say basically, what's going on here? Like, why can't we have it's not ego, it's not pride, it's just recognizing that we should have these abilities. We were trained, or supposedly trained, to be able to, again, apply critical thinking, to have some scientific rigor when we're analyzing something. And when I did that, it's not like a whole bunch of people said yes. A lot of them came back with, like, how dare you kind of thing. And the few people who did support what I was saying, they were almost always older. Okay, because they hadn't been indoctrinated by this nonsense. They were terrified to speak publicly. So they would do, and again, when I say public, it's only among the psychologists, but I mean, not back channel. They would only reach out to me back channel and say, we agree with everything you're saying. We like what Jordan Peterson is saying. Okay, we also see this indoctrination, but they said, I don't want to lose my career over it. So I saw the bias firsthand. Again, I was canceled eventually. And by the way, just a few months ago, I thought enough time had passed. So I reached out. And I said to the to the Ontario Psychological Association, I said, hey, by the way, it's been a number of years. Can you bring me back in? Okay, I promise I'll behave. Okay, I said, I just want to be back on the refer. I want to be able to refer people. Okay, because I used to be very public. I was on all TV and radios 3-5 times a week. So a lot of people would reach out to me wanting to get help. And sometimes it was in a field that I wasn't an expert in, or they weren't in the location that was convenient or something like that. So I would be able to refer them to colleagues like right away. Because even though you were paying for it, like people have to pay for it in Ontario, unless they have private insurance, but still sometimes it's hard to get a psychologist. So I would put these referrals to the listserv and say, hey, if anyone can take this client or this client, please let me know. I'll give your name to somebody. So I was able to really direct a lot of people to help right away. Okay. People who are, who say, yeah, that's my field, I'll do it. Right. Or, if they want a culturally sensitive person in this area, I'll do it. It was amazing. So I said to them, please, I won't even go on the listserv. Just let me back to be able to, again, refer. And they said, nope, you're banned for life. It was 2019. And it was just a few months ago when I asked again. So
when you look at the field of psychology, I compare a lot of this social justice ideology to a religion in the sense that there are people who are willing to kill and die for the faith. And then, just like there's atheists who say, God bless you, just because it's kind of what we do. There's people who have their pronouns and their email sign off. It's just kind of what we do here, And I'm wondering, when you look at the field of clinical psychology, how many people do you feel like are true believers, and how many people you feel like are just kind of going along with the crowd because that's what we do here?
it depends on the age group. Okay. And now the people who are just going along because that's what we do. Okay. A lot of them, the younger ones, they've just become true believers because they become so immersed in it that it's natural. It's like, hey, like the world, the earth is round. There's gravity. Okay. It just becomes that is what it is. So the younger people, I think most of them are true believers. They may not be, ardent supporters, but they don't question it. That's the thing. Okay. They're not being critical thinkers. So older psychologists, I would say a lot of them weren't they saw what this garbage is. Okay, many of them did. All right, and most of them are retiring though. And many of them are saying, "I can't work with these younger people." Okay, because God forbid I say something that they don't like. Suddenly, I'm labeled A, B, C, D. Okay, so a lot of people are getting out of the field. The ones who either who were going along with it just to be nice, okay, or who didn't even go along with it. Okay, but so I would say today, most people who are raised in in the education system, whether it's university, grad school, or lower, I think they are just being so indoctrinated by it that again, they may not be such a strong go go go, but they just assume it to be it is. That's what they keep hearing, right? That's what they keep hearing. So it's like a bunch of phenomena in social psychology that we took for granted because all these studies said that these things were true. And you heard it over and over and over and over, and so you don't question it. And if you go look and you look into it, you go, "Oh my gosh, no, that study was never replicated," or "Here's all the flaws with this study." Like I can say the Milgram experiment, or the famous Stanford experiment in the basement with oh my gosh, starts with Z.
Zimbardo.
Zimbardo, thank you. Zimbardo
Yeah.
prison experiment, thank you, right? There were so many elements to it that never get told. So people just took the story at face value. They didn't dig deeper. So it is what it is. They may not go, yes, Zimbardo, but it's factual to them. So I think a lot of the stuff that's happening, people are just doing it. It's just, if everyone's doing it, then why question it? So I think most people today, the younger ones, that's what they're doing. Same with like the pronouns in the bio. Like, again, a lot of people, if you have to do it because that's what your work says, I'm not going to begrudge you. Okay. If you're doing it to make a political statement, it's like, why? Like, why are you doing that? If you do it because you believe it, fine. Okay. Like, that's not a hill I'm going to die on. If I was forced to put in my bio, I would. Okay, if I had to, okay, and I'd probably tell people when I'm introducing them, I say, look, I know they're in my bio, but I'm just being forced to. Like, I want to work here, okay? But I don't even know if I would actually, I'm saying that, but I've never been forced. And quite frankly, I'm going to maybe retract that because I've made stances and I've made a lot of enemies and I've lost a lot of opportunities because of those stances. So you know what? I don't know if I would put them in my bio, quite frankly. I just came into a 360 there, so I'm not sure.
Another experiment that I would add from social psych is Solomon Ash's experiment on conformity.
Yes.
It's like you hold up the lines. It's very obvious which lines match, but then 5 or 6 people right in front of you give the wrong answer. Right. If you're in a room of other clinical psychologists or therapists or whoever, your colleagues who you respect, and you're counting on them respecting you, and your social capital depends on that. Your professional standing depends on that. And all of them say the appropriate treatment for gender confused children with mental illness is to run these medical experiments on them. And 5 people before you say that's the appropriate treatment. Are you going to have the courage to say, I disagree when it comes to you?
Right. And especially for younger, for anybody, for sure, even established psychologists, most will not. It takes a certain type of personality who will say, wait a second, no, that line, it's B, not C, right? And that's the minority. It is the tiny minority. And I'm just finding psychologists these days, I'm going to use this term, and I've talked about it on my podcast, and it's not my term, other people have said it, but the feminization of psychology. I think this is what we're seeing. So what you're saying, in normal times, I think that would be true, where most people would not want to be the nail that sticks out to get hammered, an old Japanese proverb, okay? They would just go along with the flow, all right? Just as you say, you're a professional, your social capital depends on going along with that, right? Especially if you're a new person, like, who am I to challenge, common wisdom, right? Or common thinking. So where's it going with that? That was in the old days, okay? And today, I had a point. Okay, I'm sorry. I lost myself in that thought about oh yes, if you're young right now, yeah, and everyone's saying that you have to do this, and if you don't, okay, in the old days, if you don't, maybe people look at you sideways. Today, if you don't go along with it, you are now tarnished. You're tarred and feathered as bigot, transphobe, and there are serious repercussions. You will never work. And again, by the way, a few young people who did reach out to me back channel, every single person said, I can't say anything publicly. They said, I agree with you, but I'm still starting out. I need to get the jobs. I need to get the internships. It's literally impossible to do that if you say anything publicly. Google, whatever, people, they're going to check. and they're going to see what you've said. And if you disagree, you will not get the job. And so, yeah, it's only got worse. The indoctrination is really bad. It is like a religion. It truly is. And when you challenge it with facts, with critical thinking, you get the same type of response that you get from people who are indoctrinated into a cult or who are, religious zealots. You get the same type of illogical, emotion-based, hateful responses and retaliation.
Can you tell me a little bit about your cancellation, that whole, what went down there?
Okay, well, there's two versions. There's a version that I give, which is the truth and it's documented, and there's the version that the OPA gave. So what happened was, as I was saying, ever since 2016, I was coming out and I just kept giving article after article, like either published article or article in the news about this. The gender madness was getting worse and worse and worse. Okay. And I would be pretty blunt about it. I say, guys, what are we going to do about this? We are psychologists. We should be at the helm. We should be the ones who are saying, here's what the knowns and the unknowns. Okay. Here's best practice. I kept saying best practice. Not just going along with what WPATH, the World Professional Association for Transgender Health, which is led by some scientists, a lot of activists, okay? And a lot of the scientists happen to be either trans or non-binary or have a partner or a family member who falls into these groups. To me, that wasn't very critical thinking-ish. It was more, again, I think ideologically based. So I was saying we need to be at the forefront. And I pushed and pushed and pushed for this. And because I would get attacked, again, I would come up with something and people would just come at me really hard. Well, I'm going to come back just as hard. But the hardest thing I usually said was, tell me where I said that. They would accuse me of saying something. They put words in my mouth. It's all in black and white. So I'd say, where? And I'd go by point, say, where did I actually say that? And I would hold them to account. And I was never swearing. I wasn't name calling or anything. There was no ad hominem. It was just I would stand my ground. So that went back and forth for a couple of years. I got warned by the president at the time. He was a very nice person. He was saying, please, Oren, stop this. There's so much heat on the listserv. He said, people are telling me they're going to quit the OPA because of all these back and forths. I said, they're adults. If it's if it's a message on the listserv coming from me and I have a subject header, they know what it's going to be about. Just don't read it. And he actually told me, he said, some of them are telling me that they're getting traumatized by, I think he's saying he's triggered for sure, definitely triggered. He may have said traumatized. I know he said triggered from just seeing the email. He said they can't even go on the listserv anymore because of that. These are grown adults. These are psychologists. So this went back and forth for a couple of years. And then finally, here's what happened. I left the OPA because I said, this is just ridiculous. Oh, before I left, by the way, I said, we need to take a stand. We need to be the ones who are at the forefront saying, these are the knowns and unknowns. Here's best practices. So one of the people on the committee said to me, okay, start your own, there's different subsections in this OPA listserv, so you can start your own group. I said, okay, great. So I started sending out emails trying to recruit people and I wasn't getting any response. I thought that's strange. Eventually I find out after a month that all of my emails were being blocked. Okay. And first of all, they denied it. They said, that doesn't happen. That didn't happen. Okay. And I kept pushing. I said, I'm asking people if they're seeing my emails. And eventually they admitted, yes, again, I have the chain. They said, okay, yes, we did it. All right. So I thought, okay, you're telling me to solve the problem. Here's what I need to do. I try to do it. I can't do it because you blocked that. So I said, this is ridiculous. So I left. And I think it was 2019. And I went to the other organization, the Canadian Psychological Association. And as soon as I got there, I realized, wait a second, you don't have a listserv. And you don't have a referral service. Like, what the heck is this? So I immediately went back to the OPA and said, hey, look, I really want to be able to refer people out. Okay. And I said, if you don't want me on the listserv, I won't. Okay. I said all that. And they had a committee meeting. They dragged on for months. Okay. And then finally they said, no, we agree unanimously. You are not to ever come back. Ever? Never. Okay. And that was 2019. So, okay.
Was there one comment that they said, it's just a repeated history of transphobia?
Well, it was more about a repeated history of, let's say, what's the right word here? They didn't like how I conducted myself on the listserv. Okay. And by the way, before that happened, on my Doc Amitay website and on Doc Amitay YouTube page, okay, I actually, I have the document that has all of my emails. Not on the listserv, but back channel, maybe on listserv as well. I can't remember. I think it might be on listserv too, but I don't show other people's because I don't want to, even though I can show other people's emails, I asked my college and they said that might be bad form. Maybe they thought it was like for private, like that they expected privacy. So I don't put their emails, but you can see my emails and you can see how I respond. And so you can infer what they were saying from my responses. The point is I documented everything. So they just thought that my conduct was unbecoming of the listserv. Okay. And again, I'm telling you right now, no swearing, no attacking. It was just, I was very adamant in saying, here's the problem. We need to fix it. Okay. And whenever someone, like I said, when they put words in my mouth or when they said nonsense, let me give you an example of the nonsense. Here we go. Okay. This was, I guess, 2019, just before I got canceled. All right. No joke. This is someone who said this. And I said to him, I said, really? You actually said this? And again, I was more polite than I'm being now. Okay. But he said, what kind of a young person would ever pretend to be transgender? Okay, for social clout. He said, do you know how difficult it is for trans people? Blah, blah, blah. Okay, like nobody would ever claim that identity if they're not trans. And I said, and this was 2019. And, it seems like a long time ago, but the trend had already started. Young people, like the numbers were already skyrocketing. We know that, right? 1400% increase and so on. So, and I said to him, I said, how can you say that? And again, I was not rude about it. But that's just giving an example. This is the kind of stuff that was still pervasive within the psychologists. They didn't know what they were talking about. Most of them hadn't worked with trans people. I still do work with trans people, which is really funny. I always say this to my students as well. I said, if I was actually transphobic, I said, my patients would be the first people to make a complaint to the college because I would be harming them, right? They know I'm very respectful. They know I'm working with them. They know I'm trying to, I'm there for their best interest, okay? But I got labeled again on the listserv. It wasn't just as transphobic. It was just, I am a menace to the organization. That my presence was toxic.
I'm trying to be as understanding to their position as possible. And in 2019, there was a lot less research available. Like you said, there was some popping up, but there was still some ambiguity of, we don't know what's going on here. Like there's hardly any studies. The studies that we had were small sample size, blah, blah, blah. In the last couple of years, you've got systemic reviews coming out of Scandinavia. You got the CAS report coming out of the UK. All of them incredibly damning towards child gender transition. You got the WPATH files that show that a lot of these people knew what was going on. They knew the harms. They suppressed good evidence. They propped up bad evidence. In the last couple of years since that new evidence has come to light, have you seen a shift in tone or attitude amongst your fellow clinical psychologists?
Nope.
Not at all.
No, not in Canada. Not in Canada. And everywhere else, Canada is we're going to be the last holdout. Okay. Yeah. No, they've doubled down, if anything. Okay. We have Bill C4. I'm not sure that actually, I should have asked, where are you right now located?
I'm in Texas.
Texas. Okay. So we have it started as Bill C16, then Bill C6, and now it's Bill C4. Okay. Bill C4 bans conversion therapy. Okay, for either, for someone who, for sexual orientation, which should be banned since it doesn't work, but also for gender identity. Now, Bill C4, the way they worded it, they made it better. Bill C6 it was terrible that any psychologist who even questioned, why do you think, let's say a biological male, why do you think you're a girl? Even that would have basically not only lost their license, but you could have been in jail. Okay, so they made it better in Bill C4 where it says if you're doing this just through exploration, right? If you're not trying to push the person in one direction, if you're not trying to push the person toward cisgender identity, okay, you're allowed to push them to transgender. That's okay, but it literally says that in the bill. If you're pushing them, if you're trying to make them cisgender, then that's if you're not trying to push them into cisgender, it's okay to explore. However, unless you're recording all of your sessions, if you have a patient who thinks that they're transgender, and you just, again, you explored, you were asking things, you never tried to push them one way or the other, they could feel that you were trying to push them because maybe they said something that makes no sense. And so you questioned it, maybe use Socratic questioning or anything, and they could misinterpret that or twist it deliberately into this person did try to push me into a cisgender identity. And then you would have to face not just a complaint again, but criminal charges. That's a law.
That it's institutionalized insanity. Is there any other diagnosis where the prescription is for all of the rest of society to affirm the delusion? Like, we don't demand that people treat anorexics as though they're actually obese. Like what is so special about this one condition where it's like we change all the rules for it?
Well, that's where the ideology comes in. People just wanted to be, good, kind, compassionate. That's what most psychologists want to be because, that's why they got in the field. They heard these horror stories about, let's say trans people being discriminated against. And there are, look, I've heard so many stories, and it does touch my heart if someone loses their job, okay, or their home, out of bigotry. So that is very sad, okay. Or if a parent beats a child, badly because the kid's not conforming to how they should behave, and so on. So I have all the empathy and compassion for people who go through some real hardships, and a lot of psychologists, obviously would feel the same way. So they're just trying to do right by these individuals. And as what a lot of people don't understand is when your college, whether it's endocrinology, whether it's psychology, whether it's, whatever the college is, okay, when a diktat is passed from the top, okay, it's not that there was a huge meeting where every psychologist or whoever got together and agreed that this is what best practice looks like. It's a tiny handful who claim to have expertise. They are the ones who, make the rules. And so everybody else who's maybe just more of a general practitioner, so to speak, they say, well, it's not my area of expertise. If this is what is supposed to be best practice, okay, let's go along with it. So a lot of younger people are not being taught to be critical thinkers. They're not being taught to challenge the evidence. So if they hear this is what you're supposed to do, they go along with it. And part of that goes back to the like you said, like the religion. If they are told that somebody can be born, quote unquote, in the wrong body, or they're biological male, but their gender is female. If they're told that this gender is a real thing, even though there's no way to measure it, I mean, you can do studies, you can do surveys, you can ask questions about it, but it's not a solid construct that you can say, yes, this is unequivocally a real thing, right? They are just going along with it. So how does this happen? Once again, not enough people stood up and said, wait, does this actually make sense? And so they all are buying into this belief that, yes, a child at 2 years old, if it's a biological boy, if he says he's a girl, he knows his gender, okay? And even if they're pre-verbal, that's a famous video you may have seen with Diane Aronsaft,
Yeah.
right? With the
Yeah.
barrettes, kid takes the barrette out of the hair, or the boy opens up his onesie. He's showing the world that he knows it's a dress. Therefore, he's a girl. And this girl's taking out the barrettes, unlike every other child does, right? So therefore, she's a boy. This insanity. And that video was, I believe, to a bunch of like nurses or other medical professionals, right? So they once again, they are putting absolute faith and trust into a small handful of people, okay, who are the supposed experts. Once again, they're not asking the right questions. And many people don't ask because they're afraid. Others, once again, because from in the newer education, they're just told, go along with it. Sorry, they're either told or they see, because they see their classmates, by the way, right, Ryan? I mean, I don't know if you experience it or you've had other people. I've had so many students who tell me, okay, whether it's about the gender issues, whether it's about, any controversial concept, when they questioned in class, they got attacked by other students, right? Or even the professors. They lost grades and so on. So, social learning, if you see other people getting attacked for speaking up, you learn pretty quickly. You quiet down. Now, I never learned that. Okay. I saw people getting attacked. I was like, no, if they're right, I'm going to join them. Right. But that's a small minority. People like you who are doing this podcast, or I see your book in the back, right? Like when people like you who are speaking out, or me, like who are speaking out, we are in the tiny minority. Most people, their self-interest dictates that they just stay quiet. So, and I understand, but I don't agree.
Yeah, yeah. Something about you talked about like just this virtually limitless trust of experts. It reminds me of the Stanley Milgram obedience to authority experiment, where I could be getting the numbers wrong, but I think it was like the compliance was twice as high if the person giving directions had a lab coat on. And it's like, hey, a 1-year-old knows they're transgender. That's absurd. Oh, I'm a doctor. Oh, okay. Yeah. Do you see that? Just like blind trust of authority.
Well, you mean among colleagues?
Yeah.
Yeah, that's the crazy thing. Yes, that's what I'm saying. A tiny handful of supposed experts, and they never question. And by the way, I brought this up as well, and I would get slammed for it. I said, have you ever looked at who these supposed experts are? Virtually all of them are trans themselves, or they have a partner or a family member who's transgender. Okay. And I've had a number of patients or even strangers come to me and tell me that when they went in saying that they were confused about their gender, okay, or anything about their identity that falls into that realm, if they were ever pushed, they found out that either the therapist was trans themselves or a partner or a family member. So the cognitive dissonance, like they can't They bought into this either for themselves or a family member and so on, that they can't separate themselves and go, wait, is this the best thing for the person in front of me or for society in general? They can't do that. So these colleagues who just blindly follow it, again, it's a lack of critical thinking. And that's why I was saying from the very beginning, as psychologists, we should be the best or among the best critical thinkers and say, where is the evidence and where is that evidence coming from and how credible is it? You mentioned as well, the studies are the low sample sizes, the data that are not included, the dropout rates, right? Like when we say, but yeah, people are happy 2 years later. Well, it's usually shorter, like 6 months, 1 year, 2 years later. Well, that's the honeymoon period. And let's look at how many people you start off with 100. Now you have 50. Those 50 are happy. But what about the other 50 that dropped out? Okay, right? Well, we'll just assume they're happy. Right. So like this is the kind of stuff that if it was any other subject, if it wasn't such a third rail subject, I would hope that they would be able to go, wait a second. We learned in graduate school or in undergrad in research and methods, courses that there's a problem when you have such a high attrition rate, right? We have to ask what's going on here. They're not applying any of it. So it really boils down, if I had to put it into 2 words or 4 words, lack of 2 words, critical thinking. That's what it's about. Okay. And cowardice, quite frankly.
It almost feels like for normal areas of study, there's this threshold right here for like empirical evidence and the scientific method, things like that. But with certain issues like the trans issue, it's up here beyond the level of evidence to the level of sacred, where it's like, the evidence is irrelevant because this issue transcends kind of the worldly, earthly level of evidence. This is a human rights issue that's so far beyond that. It seems like how it's treated.
100%. That's why, again, we go, it's almost cult-like. It's against faith. It is faith. And how dare you challenge the faith? That's what I was saying earlier. You get excommunicated or, you get called the worst things. I've been called a lot of things. And here's the crazy thing. And again, you see these interviews with people on the streets, like, Billboard Chris. I did a podcast with him a couple of years ago, and when he started off, and so like I've watched him progress. Like he's stuck it out, and he's just he's beaten up, he's been assaulted, he's been I think he's been detained if not arrested, right? But he's stuck it out. And when he has these interviews with just people on the street, you see the irrational thinking. You see them unable to keep a consistent thought. And the one I'll say in a second is the sad thing is I saw the same stuff happen, not with people on the street, but once again with colleagues. And I want people to understand that these are the people, the psychologists, whether the young ones or the older ones, these are the people who are making the decisions. These are the ones who, well, to the lay people, they go, well, if the whole psychological association agrees with this, it must be right. No, the whole association doesn't agree with it. Okay. But just most people are afraid to speak out. And what it is if you're talking about, as you say, a human right, okay, if we're trying to be compassionate, all the evidence shows that a child before puberty has no idea whether they're going to continue to say, I am trans after puberty. We don't know that. If left alone, up to 96%. Now that's a bit of a skewed number. The best numbers would be say 80%. If you didn't say anything to the child, if you didn't socially transition them or anything like that, if you just stepped back, said, we love you for who you are, whatever, and that's it, and you watch and wait, 80 to 96%, 96 that's more about just gender, like non-conforming. But a lot of those gender non-conforming kids are the ones now who are being pushed into, this trans identity, especially if they have autism, that they latch onto this. Anyway, the point is that the vast majority of kids, up to 96%, if you said nothing to them, once they go through puberty, they would say, wait, of course I'm a boy. I'm not a girl. Okay. And they would, be okay in their body. They might feel a bit uncomfortable, but they would realize that, staying in their actual body it's favorable to suppressing your hormones, to using these cross-sex hormones, to going through surgery, right? And the fact is, right, we know that cross-sex hormones can lead to permanent sterilization. How much of a human right is being violated when you say to a child as young as 2, 4, 6, or 8, whenever, you start to socially transition them, which puts them on the pathway to the puberty blockers, which puts them on the pathway. 98 to 100% of people will go on to cross-sex hormones if they're on the puberty blockers, right? 98 to 100%. So at a young age, if they're making this decision before they have the wherewithal, before they even understand what orgasm is, before they understand, do they want to have, children in the future and so on, right? They're being put on such an irreversible path at such a young age How do you say to yourself that you're a good person, that you care about human rights when you not only allow this to happen, but you encourage this to happen? That's the part that they don't understand. And I have not seen any, or sorry, I've rarely seen, I've seen a few, but rarely have I seen psychologists, again, forget the person on the street. Rarely have I seen psychologists be able to answer that. All they say is the child knows who they are. I go, okay, then what about the many people who say, wait, who do detransition? Oh, that's only 1%. No, actually, newer studies are showing up to 30%. And by the way, it's going to be much higher because the ones who detransition, there was a study that was done by some of my colleagues where they show that most of the people who detransition, they never go back to their doctor and say, hey, by the way, I changed my mind, right? Because they're disgusted with them. They were betrayed by them. So they don't go back. So it's much higher than 30%. And that was in the old days. Today, it's going to be like, I'd say 80 to 90%, if not higher, are going to show a lot of regret because it's a whole different cohort than it was a number of years ago. Because back then they had proper screening, they had proper, like they wouldn't put somebody on the path until they, and even then there was some question about how good their screening was. But in theory, they really screened out. They screened out for other mental health issues. They made sure that this is the best decision for this person, and they followed them up. The kids today, right? They're not transgender as we used to think that trans was. And they don't even say transgender anymore. They just say trans as a more broad umbrella term. Today, trans can be anything. Okay, it's and to, by the way, I'll just throw this in there. I'm sorry, but for psychologists to deny the very well known phenomenon of social contagion. Okay, which is what we're seeing with so many of these kids. Not everybody. Some people truly do have this belief, okay, whether it's neurological or whatever happened to them, that they are transgender. I will say that, and as adults, there is a small percentage of people, a tiny, tiny percentage of people who I think, as radical as the surgery may be, as an adult, if they've said, I can't live in this body, and I truly think that if I can't transition, I'm going to kill myself. Okay. A lot of people don't like when I say that because they think that I'm very far off from this. I'm thinking, no, if that's the only thing that's going to make this person better, if electric convulsive therapy is the only thing that's going to help somebody, then these radical interventions may be the last course of action. So, but these are for adults. These are for people who've tried and tried and tried, not for adolescents, not for children, definitely. So again, so for colleagues to deny social contagion is happening, even though we know we've seen it with people claiming to have been abducted into sex cults. We see it with the eating disorders. We see it with suicide. Why wouldn't it be something like this that has so much clout these days? And it's affecting the target population, young girls. Okay. Like, it's obvious. Sorry, that was my rant, but I had to throw it in there.
You're good. You're good. I'm wondering if you see the fields of psychology, clinical psychology, therapy, you see these fields as uniquely vulnerable to being hijacked because of what a premium we place on empathy. That's kind of the Carl Rogers mentality of empathy is like the number one thing that you can't do without. And you kind of have this mentality where it's like, well, people in the past have turned a blind eye to racism and misogyny and homophobia. You don't want to be like those people. You want to be on the right side of history. You want to care about people who are suffering and have compassion for the marginalized, this type of thing. And then kind of before you even realize it, you're promoting these bizarre, sadistic medical experiments on children. Like, do you feel like that need for empathy is part of what makes us vulnerable as a profession to being hijacked?
I believe so. And especially the way that you framed it. And that's how it's being framed to them as well. Okay. Psychology in the past, or psychiatry, or any, mental health area, betrayed or neglected, these marginalized groups that you just mentioned. So we want to be better. We owe it to them. And so, yes. And again, the empathy part. And it's not very empathetic when you are, allowing people to do things that's harmful to them. That's not true empathy. But yes, I do believe that we are particularly susceptible to that. And that's why I was saying about the feminization of psychology, because, and when I say that, I want to be clear here. My podcast colleague, she's a woman, and she talks about the feminization as well. It's not literally saying about women. It's about this being overly agreeable, maybe not using as much logic as necessary. And it's not about women per se, because we have a lot of males in psychology who are doing the same thing, that they've allowed this field to get feminized. So yes, the empathy is part of that. The agreeableness, not wanting to rock the boat and everything, that truly I think is part of the problem.
In the US, race is a very big deal. I remember during the COVID pandemic, it was like, we have to lock down, and if you ignore lockdowns, then you're basically kind of trying to kill your other citizens, your fellow citizens, because you don't care about spreading the virus. And then Black Lives Matter broke out, and it was like all that just kind of went out the window because we were told the real virus or the real pandemic is racism, and your civic duty is to participate in these protests. I'm wondering what you saw on the Canadian side with regard to the race issue.
Yeah, we saw exactly the same thing. Okay. And we take on America's burden as well. And is there racism in Canada? Of course there is, but we don't have the same history. And I think it was a total of 7,000 slaves, black slaves in Canada historically. I think that was the number. I could be wrong, but it was a tiny, tiny number. It wasn't like it was in the States, but we act like it was. And yes, there was definite racism and horrible acts committed against our indigenous population. Right? Our First Nations people suffered and continue to suffer. So we have that, okay? But I don't see that nuance being brought in. I just see, a whole bunch of psychologists and people in the fields, various fields, just throwing up the BLM flags and everything like that. And again, I was one of the people saying, at the time, I was already kicked out. I was already kicked out of the OPA, but I would have been saying, hey, guys, okay, let's be calm here. And actually, I did give a TV interview where I said exactly that. I said, I can understand why people would be really upset because they were being told, lock down yourselves, lock down your children, don't let them go to school, don't do this and that, right? Don't see your dying parent in the nursing home. But hey, 100,000 people on the streets for Black Lives Matter, no problem. I said that on the TV. I said, can you understand why some people would be very, cynical, untrusting, and very upset about that? So yes, we had the exact same problems. And like I said, a lot of the times our problems are not exactly the same, but we act as if they are, and we react the same way. Okay, like it's ridiculous. There's a lot of what's the right word here? Virtue. I hate to say it, but I hate to use these buzzwords, but the virtue signaling up in Canada is extremely high, or is prevalent.
How do you fix the fields of clinical psychology and therapy?
The solution, it's pretty simple, but I don't think it's going to happen, unfortunately. You get the people in positions of power, whether it's at the universities or in the college or in the in these volunteer organizations. You get the people at the top, the presidents, the board of directors, and so on. You get them to actually have a push and saying to people, look, we want to be helpful. We want to be empathetic. We want to serve the public. That's our job. However, we've made some mistakes. We've had some missteps. We've let ideology overrule critical thinking or best practices and evidence. So that's what it would take. And it would have to happen at the university as well, where they would have to teach the courses. They would have to start saying, okay, let's go back to the principles of, of good science and do that. But again, you need the people at the top, but it's not going to happen because the people at the top want to stay there. And if they were to say that, unless everybody at the top, if there was two people at the top or three or whatever, all who said, hey, you know what, just so you know, I'm on your side. I understand this is madness. Let's change it. If enough people felt that it was safe, then maybe we would do it. But no one's going to do it. They're just too afraid and they can't get to the top. If there's someone like me or you who have these, I don't know, the right way of thinking, I believe, okay, which is based in reality, how are we ever going to get to the top? Right? I'm not going to be able to, I'll tell you right now, I can never be hired to teach anywhere at this point because all they have to do is Google my name and they will think I'm this horrible person, blah, blah, blah. Why would they take a chance with me? So I'll never be able to get to any of those positions. So I can't make that change. And, who will? I'm not saying I'm the only one. I'm sorry. There are many people who could do it, but they're not going to. So
I have a final question for you, and that is when you look at society broadly, what is one thing that we're not talking about enough that we should be talking about more?
there's a bunch of things, but I would say the impact all of this stuff on children and especially technology. I mean, it's being talked about, but not enough, right? Jonathan Haidt, he's been screaming from the rooftops for years and, more and more people are hearing it, but not enough. So I think this, the impact, because a lot of parents today, they started like the technology, the smartphones that came out when they were maybe teens and so on. So they started doing that. And so I don't think we're talking enough about the impact of all of these changes in society. And again, I think it starts with the technology. It'll be with AI as well. I don't think we're really looking at what it's doing to the human, not just the mind, but the actual brain. And I just did a podcast just last week about AI. And I think that it's just a quick tangent, but then I'm guilty of this as well. Okay. In the old days, And I used to remember phone numbers. If you gave me a phone, like I had these memory tricks, these mnemonics. Okay. So I could remember names. I'd have like 200 students, in a classroom, 300. And I'd say, tell me your name every time you put up your hand. And, then they'd be surprised that I would remember every single name that ever put up their hand. And a lot of people put up their names. Okay. And I'd do my damnedest. Okay. You give me phone numbers and people say, you want to write it down? I know, I can remember it. Okay. And I did. All right. No joke. I honestly don't know my 3 daughters' phone numbers. I've gotten them all cell phones. I know my wife's. I don't know them. I caught them. It's in my phone because that's the shortcut. That's the heuristic. I've got it locked into my phone. And I really should just sit down and do it, but I've become so lazy in that regard. And I'm just giving that as a simple example. But I think that more and more people, especially with AI now, okay, whether it's writing emails, whether it's writing a resume, whether it's doing homework, they're just going into ChatGPT or whatever AI form. And, and this is the basic level. It's going to just get worse and worse. So I think the ability to really think hard, to challenge yourself, I think that we're losing that ability. And I think technology is doing that. So I think that that's really changing what it means to be human. And we're seeing this. We're seeing that, that people are not like, they're not, let's say, mating as much. They're not having babies. They're not looking for, like, they're going, well, why do I need to do this? They just don't have this vision of a future. They don't see it as, wait, what's really valuable to me? They're being bedazzled by all these gadgets and the technology, whatever. They're not really thinking about, in the end, the existential question of like, why am I here? What am I doing with my life? I don't think that's being talked about enough to help young people and older people as well, but young people especially have a sense of purpose, of meaning, of like having values and trying to live by those values. We never really pushed that much in the old, well, I guess with religion we did, but I think more and more we're just losing sight of what it means to be a human being. Okay, especially in today's world. And we're just looking at all these gadgets and we're looking at the easy way out and we're not thinking about the consequence of that. So I think that's what's not being talked about enough. It's being talked about a lot, but not enough. Hope that makes
That's good
sense.
stuff. Yeah, I mean, this whole idea of short-term pleasure over
Yes.
long-term meaning and purpose is just so huge. One of the primary sources of meaning and purpose for people throughout all of history is having a family and having kids, having grandkids. And so much of the idea is like, well, that would kind of cramp my lifestyle. I want to go out to the bars or travel or what have you. And you're having this fun in the short term and sacrificing like this long-term greater sense of meaning and purpose. It's jarring when you look at it on a big societal scale.
It is terrifying. There is the population collapse in most areas. There are certain groups that are not. They're thriving. Okay. And that might be the new world, which is going to be scary as well. Okay. But yeah, and you hear so many young people say that today. And by the way, going back to the whole trans issue, when people are saying, like when they talk about sterilizing children, I just heard this in an interview recently. Okay. Again, these are university educated people where they're saying like children who are going to, not be able to have children, their children now making decisions that is going to prevent them from ever having children. And one of the more common responses, well, who would want to have a child in this day and age? Okay, right? And I hear a lot of people say that. I've got so many patients, young patients, who they want to have a family, but they're saying, I don't think I can afford it. So they're not saying, oh, screw the world. They're just saying, I'm having a hard time imagining. And especially with online dating, how am I going to find, if yeah, I heard the 80-20 was on the adolescent show that just came out. Okay. That 80% of women are going for 20% of the guys. Wait, sorry. Yeah, that's right. 80%. They call it the 80-20 split. I'm hearing more about 90-10 or 99-1, where it feels like, right, 99% of the women are going for 1% of the guys. So if you're someone in that, and I hear vice versa, I hear the women saying the same thing. They're like, and these are pretty quality women, but they're feeling that, no, like I can't compete with the top women, or I'm not willing to just sell my soul or my body, so I'm not getting guys. Anyway, so I can understand why people would be discouraged. I can see why they'd be intimidated. But that's the whole thing about the short-term, pleasure. It's like, okay, well, I'm intimidated, I'm discouraged, I'm never going to make it. So I'll distract myself with whether it's porn or video games or, or something else, right? Rather than saying, I'm going to suffer, I'm going to struggle, I'm going to go through it. I'm going to date 200 people if I have to, in order to find somebody who might be good for me so I can have that future life that that I'm kind of programmed to want to have. I mean, that's hundreds of thousands of years of evolution. We're just stopping it like that in like 1 or 2 generations. That's crazy.
You brought up a really good point because, you're not just competing against all the other men or all the other women. You're also competing against romance novels and pornography, and just like, I can just be alone and focus on short-term pleasure, and I might get more fulfillment out of a relationship, but it causes anxiety and discomfort, and you fight in relationships. It's a lot of icky feelings that I don't want to deal with. So I'm just going to isolate and focus on the short-term pleasure. And like society wide, we're robbing ourselves of that longer sense of meaning and purpose.
For sure. And again, literally, we're going to be cutting off our future if we're not reproducing. Like, we're not going to be able to sustain the people who are here. We need a certain number of people to be born. So yes, and was it 2000? I forget what year it was. Her, the movie with Joaquin Phoenix.
Oh, yes. Yeah. Yeah. That was a good one.
Yeah. I mean, we're getting closer and closer to that with AI and everything. And people truly, I mean, again, if you were a child raised like in today's society where these principles of struggling, of fighting for this family, of having, again, a legacy for most people, I always tell people, for most people, the only legacy they're going to have is their children, their lineage, their DNA being passed on. And that's just sentiment isn't being promulgated today. It's not being talked about enough. So so with AI, when it comes out, when you're saying like there's anxiety, there's fights and everything, that's not going to happen with AI. And if this, and if AI is good enough, and I just heard last week that the AI passed the Turing test. All right. I just heard that last week.
Wow.
Yeah. Okay. That's scary. That's the next level. So if that can happen and you can put it in these forms, whether it's like her, where it's just a voice, or whether it's going to be in these bodies, in these lifelike bodies, these androids or whatever we're going to call them, again, people are going to find the pleasure in that. It's not going to, it's going to start off with like, I don't know, $100,000 or whatever for like these dolls. And it's going to be mass market. It's going to be cheaper and cheaper. And that's what people are going to go for. And, you can't reproduce with an Android.
Wow. This is scary. Man.
Yeah. I didn't mean to end on such a down note, but hey, you asked. So
I mean, I feel like all of it was kind of a little depressing, the whole conversation. But
sorry, I have that effect on people.
I guess before we go, I said last question a few times, but is there any optimism that you have looking for the future?
I call it a bit of blind faith. Okay, and we were kind of crapping on blind faith, but my blind faith is that, and I got to be clear here. I don't care what people think about politics. I am personally not a fan of Donald Trump's. I am not. Okay, I just see his personality, and I don't like him at all. Okay, but if I were American, I would have voted for him. Okay, he's the president. Like, because if you think of the opposition, that really. And I'm going to tell you right now, up until the election, I started feeling the kind of feeling that I had so many patients feel in 2016 and in 2024 when Trump was elected. We're Canadian, and yet people have so much anxiety. The Trump derangement syndrome is real. Okay. And I was really thinking, oh my gosh, if Kamala Harris gets elected, I really thought, what the hell is going to happen to this world? We are doomed. Truly, the West as we know it would be gone. So Trump was the person who, I mean, I think he's dropping the ball quite a bit right now. He's like a bull in a china shop. All right. I'm hoping. So my blind faith is that the people around him will rein him in, and that the right decisions will be made, and that, they'll refine it. Okay. They're coming in with a chainsaw, right? After the chainsaw kind of hacks away and whatever, bring the scalpel, bring the glue, put it together. And I'm hoping that some decisions will be made to bring some sanity back to society. And I'm hoping the same thing happens in Canada. It looked like it. The front runner, Pierre Poilievre, okay, he was a conservative, right? He had such a lead. And now he's second place. And this Mark Carney character, who, if you just do a bit of reading on him, this man's a dangerous person. I don't trust him at all. He's going to screw us over. He's going to do the same thing that the Liberals did to us for 9 years. And again, it's maddening. So my blind faith is that maybe these polls are being rigged. Maybe on election day, enough Canadians will go, whoa, whoa. We're going to elect this person. And I don't trust Poilievre because he's a career politician. You can't trust a career politician. Okay. But again, to me, the alternative is so scary. So my blind faith is that enough people in enough countries are sick and tired of it, and that the pendulum doesn't swing too far back. That's what I always tell people. It swung really here. I don't want to go too far back, because then we've seen what that's done. So I want to swing about here, bring it back to sanity. So that's my hope, that enough of this can be course corrected.
I feel like that's very close to my hope as well. And I worry that people like us are never going to get what we want, because that pendulum never stops in the middle. It's always far to one side or the other.
Yeah. Well, again, that's where my blind faith comes in. That's all I've got, because otherwise I'm not going to be able to sleep at night.
Well, I'm hoping in the same direction as you are. So, Doctor, thank you so much for a great conversation. I love this. Would love to talk to you again sometime.
Thank you very much. And I always tell people, I'm sorry for my verbosity. That's my neurosis, but I appreciate having the chance to talk about it. Yep.